Hi, I'm Michelle Risser, and I'm a licensed therapist, and let's go over exposure and response prevention therapy. Exposure and response prevention, ERP. This is a type of psychotherapy most often used to treat obsessive compulsive disorder, or OCD. ERP is a specific form of CBT that helps reduce OCD symptoms by repeatedly exposing people to the anxiety triggers while teaching them to resist the urges to engage in compulsive behaviors. ERP treatment is typically completed in about 12 sessions and is considered complete once the client has successfully faced their higher level fears. Sessions often start at 60 to 90 minutes in length and get shorter over time. As its name suggests, ERP has two major components: exposure therapy and response prevention. The exposure component is when the therapist guides a person through imagined or real situations where they are exposed to their triggers. Triggers might include specific thoughts, images, or memories, which are called imaginal exposures, or they could include actual feared objects or situations, which are called in vivo exposures. The exposure process is gradual and progressive, starting with the lowest anxiety-producing exposures and gradually moving up towards exposures that trigger high levels of anxiety. Response prevention is part of ERP treatment, and that helps people resist strong urges to engage in a certain behavior or compulsion when they are anxious. While preventing someone from using a coping skill might sound counterintuitive, the reality is that OCD compulsions are usually disruptive and not helpful. Response prevention can interrupt and even reverse the progression of OCD symptoms. How is ERP different from standard CBT? ERP is focused on reducing specific fears and fear-based behaviors like those associated with OCD, including checking, washing, counting, and avoiding. The techniques and methods used in ERP treatment are also more specific than in standard CBT treatment. Some other disorders that have been effectively treated with ERP include hypochondriasis, Tourette syndrome, body dysmorphic disorder, anorexia, and bulimia. We will include links to articles we've published on disorders effectively treated with ERP in the description below. Some of the techniques and activities used in an ERP include psychoeducation, which includes providing detailed information to a client about their diagnosis and symptoms. A fear hierarchy. Early in ERP treatment, the therapist will work with their client to develop a list of anxiety triggers that begins with triggers that cause low levels of anxiety and moves up the ladder to the most anxiety-producing triggers. Self-monitoring. ERP therapists ask their clients to self-monitor or track their symptoms and triggers between sessions. Exposures. Eventually, ERP therapists will guide clients through an exposure where they are asked to intentionally confront one of the lower-level triggers on their fear hierarchy. And response prevention. This aspect of treatment is essentially asking a client to experience or tolerate a strong urge without acting on it. How long does ERP therapy take? Depending on specific symptoms treated and individual differences of the client, ERP can begin showing positive effects almost immediately. After the first session, the person could experience a reduction in symptoms. After 4 weeks of treatment, people using ERP can start to show a dramatic reduction in the severity of their symptoms. Much of this progress will continue over time, but some may require additional sessions in the future to maintain their progress. How to find an ERP therapist. Most people begin their search for an ERP therapist online. Using an online directory, you can narrow down your search using built-in filters. You can use these filters to help you find a therapist who's close to a certain location, who specializes in ERP or OCD treatment, and who is in network with your insurance carrier. In many instances, ERP therapy is covered under insurance plans, which can make it more affordable. Another way to find a network therapist is to go directly through your insurance provider. You can call the number on the back of your insurance card or go online to use the insurance carrier's online search tools. We've linked some valuable resources in the description below to help you find a therapist, psychiatrist, and other helpful tools.